Okay, my name is Maria-Teresa JnTala and I'm the Deputy Principal Perfusion Scientist at Glenfield and the LRI Children's Hospital. So I've had about maybe 14 years of experience. It's been a pleasure. It's exciting. The role requires a lot of thinking outside the box sometimes, especially for mobile transport. It also involves a lot of multidisciplinary work with the teams. So very good communication, very good analysis of what you have at your home base and where you're going to for mobile transport. It's been exciting, I would say, overall. I believe it's quite essential because it allows you to have the exposure to certain situations you may not be exposed to. So, for example, for ECMO situations, we sometimes have roundabouts where we have a lot of patients coming in, maybe seasonal, depending on maybe the H1N1, flu, viruses and different things. But then you have some times where you don't have. So you may go years without actually having a trainee or actually a qualified member of staff being exposed to anything. So having simulations allows you to have a controlled environment that you can practice safely before you actually work on a patient. And it just increases your ability to do things, your techniques. You can learn different skills. You can learn different ways to adapt things for really essentially just optimizing the best for the patient. And I think it's a great tool for trainees. I think decades ago we probably didn't have the access to simulation we have now. And it's fantastic for trainees. They learn things, as I said, the exposure is the main thing for me. So I think simulation helps, first of all, reduce risks because primarily we're not actually actively on a patient, but also it allows you to have situations and scenarios where you can troubleshoot. So you're actually being able to experience and practice those scenarios before it actually happens. And again, it's the exposure. So you could be doing a scenario for children and adults in cardiac surgery, which is very repetitive. And it's the same situation. And then when you need to have an emergency situation which you're not exposed to, I guess the concept is different and it depends on people's character. Are they going to be confident? Are they going to be experienced because they know what to do? Because it's also time efficient. Whereas having regular simulations exposes you to one, the efficiency, reducing time delay because you have had the exposure to that scenario. And also the awareness of what you will need during a situation. So I think it does help reduce those parameters that we may not come across from before simulation. So the biggest difference, I would say, is being aware of your circuit size. So obviously children have a lot smaller volume, smaller surface area, so that these things play a lot into which circuit selection you have. And also sometimes it's a little bit more critical for children. You have a lot more anatomical differences compared with a normal adult. You have the congenital deformities. So I think with that, it can be a little bit more complex, the situation. With adults, you can put clear fluid and not say not pay attention, but the awareness of the fact that you're going to really dilute that patient is a lot more noticeable in children because of the small volume to surface area of the circuit. So I think for simulation, personally, it's in transport simulation. So we have had scenarios where maybe the simplest thing would be in terms of what you actually need to take with you in terms of equipment. So if you're doing a flight, really, people forget that you literally can't just stop the plane and get off. So simulation kind of, when you're doing a practical situation, is not directly with the patient, but having the equipment that you need to take with you and the backup, that's quite vital for these and doing these scenarios. Also, in terms of the patient point of view, we had on ECMO, let's say we have air emboli. So it's not often you get an air emboli, but it's how quick people can react to actually resolving the situation. And doing simulation practices where you actually introduce air emboli into the circuit, noticing different things on the parameters of the patients, it's good. So you're able to have that exposure. We've had situations where the gas line has disconnected from the circuit. You would probably not notice it as often in terms of what to notice, because there might not be an immediate color change, but with simulations you notice different parameters on the patient monitoring system. And because you have been exposed to it again, if the situation happens and you're like, oh, I know that it's not just looking at the color change, but maybe my venous sats has changed. The patient doesn't look healthy, the certain parameters, the heart rate, something's gone. So it's, I think, again, main thing is the exposure to these parameters and being aware of what to look for. So it gives you that quickness of seeing what you would not normally see. I am actually very impressed, I must say. No disclaimer for this. I'm actually very impressed with it. I think that it's there are a few little tweaks that need to be timed. Maybe it's obviously the Wi-Fi or communication between the systems, but I think it's a fantastic system you have here. The ability for us to be able to cannulate, the ability to change the parameters and from one situation to the other, and also I know you're putting AI onto it soon. So I think it's fantastic, and I look forward to doing a bit more. I like how you can change in terms of putting the baseline parameters and have situations. So you can, you input different scenarios. So you have like is it a 5-step program? So you can see a gradual difference in changes from either the heart rate, the venous saturation, CVP, and you could have a gradual decline to show that the patient is not at their optimal. So I like that feature of it, that it doesn't have to be an immediate, but you can have gradual steps through the simulation. From a personal perspective, I think it's the way forward. And I really hope a lot of centers do incorporate it in there for us in terms of perfusion background for the trainees. Because again, I will say it a lot, exposure. They will not probably have the experience, but having simulation practices in a safe, controlled environment without having any patient at risk, but allowing them to troubleshoot situations and also thinking on their feet what they can use, what they cannot use, and being aware of certain things that is like, this is a situation that is critical, time sensitive. I think it plays a very important part in training the future, and I hope we incorporate a lot more, and I think we will be, because it's quite up and coming, isn't it? So it'll be great. I think the simulator company is really good. The support we've gotten, not only from the director, but all the other colleagues, the efficiency, the equipment, it's very professional. And also not only professional, but they treat you like family. So it's a nice environment. So I've really enjoyed having the conference and having the simulation and practical sessions here. And I've already spoken to the director that when can we do more, because it just feels, you want to come to a company where it's not only professional, but you want to feel welcome, the equipment is good, it's reliable, and the staff are aware of how to use things properly. It's, in terms of experience, it's been very good. I think our delegates and also our participants have really enjoyed it. The availability of being able to have everything on one site has been so nice that we can rotate the groups. We've had small groups and the space for them to maneuver and do everything. It's been fantastic so far, and the feedback we've gotten is quite good. So I'm really happy with the workshop at the moment. I think everybody coming together actually to work well. So we've shown literally the essential criteria of having a good cardiac team, working well within a multidisciplinary team in the hospital, and done that in an outside environment. So I think that's the takeaway, is just very good working together with each other. We've had people from the simulator company, delegates, the people who provide the ambulance, and also the aircraft. and just working together. As I said before, I think for it being the first, we have points that we're learning from in terms to improve, but that doesn't mean that it wasn't good. It's been a great first course, and I think everybody would say that for a first time course, it's been fantastic. It's probably been on par with places that have had it for a number of years, and we just can improve from here. So it's been good. It's been really good. Yes, I would recommend the course, one, and I would recommend the simulators because I think it's been a great experience and I can't wait to come back to use them.